Hi, thanks for joining us today. We are, during Pride Month, going to have a conversation with Casey about barriers to care for the LGBT community. So during Pride Month, there's some people that don't even understand why we have Pride Month, and that's kind of a larger conversation. But what we really want to focus on today is how does it feel to enter traditional medical care and not be treated the way you would expect to be treated. And, you know, it's kind of interesting, even in nursing school, we are taught that different cultural groups, so Asians, African Americans, Native Americans, have different expectations of health care, but this is not a group that we're ever taught about. And even with that, we're just taught, here's the barriers that these groups are faced with, not really so much what to do about it, just that it exists. So that's something we want to talk about today. Like, what is your experience? And as a general conversation, what can we do about that as a community? So tell me a little bit about yourself and what's happened.
So my name is Casey Anderson. I'm a trans woman. I've been transitioning for about 3 years now. Started hormones just under 3 years. And so when I first started transitioning, I knew very much that I wanted to medically transition, which is not a requirement for trans people to do, but it's something I wanted. And I reached out to my primary care physician very early on and was told I can't help, that I couldn't be helped. That she didn't understand how medical transition care worked, and that the one doctor that was at that clinic that handled these things had left.
Oh my goodness. So you're just stuck.
So I was completely out of luck from the system that I belonged to. So after waiting for that appointment, because this all was happening during the pandemic, so appointments were pushed back and pushed back and pushed back, I contacted people in my support group, and that's where a lot of trans healthcare honestly lives, is within the stories within our community.
Right.
And I reached out and said, who in the area can help? And a couple people pointed, oh, I have this doctor down, Everett Clinic was one of the big places that I was being told. And I called a couple doctors. Some said, oh, we don't do that. But I eventually found one. It was an endocrinologist who specialized in trans healthcare, and he was really helpful. Gave a lot of good information at the start, kind of gave me options. He was very conservative in not necessarily politics, but in terms of healthcare.
Okay.
And he had a reputation for that at the time, of things moving very slowly. Okay.
Was it frustrating, or did you feel safe?
It was very frustrating, and it felt safe. But there's no real, there are some standards for trans healthcare, and there's guidelines to like the WPATH guidelines. Okay. And they say, okay, this is kind of levels to look for at different stages. But beyond that, there's not much. And so it's almost the Wild West out there.
The new frontier of medicine.
That's right. And my doctor just happened to be a very conservative, start off on extremely low doses, just to make sure that, you know, my legs don't fall off or something like that.
Which rarely happens with hormones, but
right. But we'd have to worry about things like make sure to watch for blood clot risks, watch for cholesterol elevation, things like that.
Right.
And so I was on board with him, and he was managing my hormones and my care well. Good. And then he quit. I just got a letter from the doctor's office one day saying, he's gone.
Oh, okay. Which happens.
Which happens, but when it's the one person.
Right.
And they're like, oh, here's another endocrinologist. And I looked him up. He was a very nice gentleman, but his specialty was in men's reproductive health. Okay. I'm like, that is the opposite in the direction that I am headed. Okay. And he was nice, but very, okay, things are working, just keep going. Just keep going the way. Okay. I'll see you in a year, I think was his last comment to me.
Wow, which you really needed some guidance and some reassurance that things are going in the right direction, that you're moving along.
Standard care that I hear is usually about 6 months, kind of just check in, make sure everything's looking well. So a year was a lot.
Well, it is a lot. And if you think about anything else, like if you had come in for any other kind of therapy, you generally don't hear, well, I'll see you in a year and we'll see how things are going. You know, there's a little bit more close follow-up to this process of whatever it might be.
Right. And this goes into what that's trans healthcare is healthcare.
Yes, healthcare is healthcare. People are people,
Yeah.
and we all need to be treated respectfully. And whatever our thing is, you know, it's you know, like at the beginning of the HIV epidemic, you know, people were being treated unfairly and discriminated against, and you know, we learned a lot then, and we have to continue with that people are people and deserve to be treated for their medical conditions no matter what is going on. It's our job in healthcare to, I don't want to say blinders necessarily, because we do need to see the people that we're dealing with, but to not bring our personal feelings into healthcare. That's not our job.
Right.
Our job is to care.
Right, and that's what, as a patient, that's what we're looking for, is just someone that can care, that can help, and give the assistance that we're seeking.
Yes, absolutely. So where are you now?
So it's Skagit Regional, and this is a doctor that as soon as we found out that she was willing to help with trans health care and help with hormone replacement therapy, her schedule basically was booked entirely. Immediately. And because I told people, they told people, so we joke that she is the hormone provider of Skagit County at this point. So then she's sending us to new people, and that's kind of how this goes. And it shouldn't have to be this word of mouth. No,
it shouldn't be. No other healthcare is like this.
No.
Yes, if you've got something going on, you're not like, well, let me call a friend and see where I should get my pap smear. Right. Yeah. One interesting thing that you told me about when we were talking was the different hospital systems and how they assign you identity. Let's talk about that.
Absolutely. So different hospital systems have different fields of information that they allow you to identify as. So for instance, I've been told up at the Peace Health System, which is mostly up in Bellingham because it's a Catholic-run organization, tends to be more conservative, and the only field of information that they have is your sex assigned at birth.
Okay.
Which is helpful information, but it's not the entire story.
No, it's not.
And so at Skagit Regional, there's a sex assigned at birth field, but then there's also a gender identity field, and there's also a legal sex field.
Okay.
So there's
a little bit more.
But even then, they get things confused.
Right.
So a great example of this I love telling is I was getting an alert in my health system, basically from the point that I was in their system that I was in desperate need of a pap smear.
Which you totally want to have.
You know, I thought about finally just filling out, going in, getting up in the stirrups and just going,
all right.
Okay.
Can you find my cervix?
That's right.
It's a challenge.
It's a fun little hunt. It's like, where's Waldo?
Oh my goodness. Yes.
And so one of the fields was setting off the flag for the system to say, hey, this person needs a pap smear.
Right.
But that's not helpful.
Yeah, it's not. And that is a huge gap in our healthcare, because there are genetic testings, there are scheduled testings that are sex assigned.
There are.
Yeah, so like a PSA for men or mammograms for women. And so we don't want to neglect these things, because they are still possibilities of disease processes starting that we need to catch. But how do we go about doing that? And how do we deal with that respectfully? Right,
because if the only field is saying that I was sex assigned at birth, I was a male, they'll never flag me for needing a mammogram.
Exactly.
And that's something that will need to happen. And other examples with trans men that still have their original parts, they're going to need a pap smear.
Yes, absolutely. And a mammogram. Yes, absolutely.
And so this kind of one-size-fits-all field option doesn't work.
No, and we need to, for many things in our world, we need to expand our views, and we need to be inclusive, essentially.
It's just that. And we're people, we're patients, we're not just one little thing.
Nobody is.
Nobody is.
Absolutely. Yeah. Well, thank you so much for coming and talking with us today. If you guys have questions, please comment. I will answer them the best I could. Casey might answer some. We would love to hear what you have to say about this. And just remember to love one another.
Thank you so much.
You're welcome.